Hello, everyone, and welcome to Voices, a library lecture series. We would like to begin with an acknowledgement that we are gathered on the sacred homelands of the Mahikaniak or Mohican people, who are the stewards of this land. Today, the community resides in Wisconsin and is known as the Stockbridge-Munsee Mohican Nation. We pay honor and respect to their ancestors past and present. Voices presents speakers on timely and enduring issues each semester to broaden and enrich the scope of studies at Hudson Valley Community College. Today, we welcome Dr. Ella Derbyshire, a family medicine physician and past graduate of Hudson Valley Community College. Dr. Ella has dedicated many years of her life to her medical career. It was a long-awaited pursuit, a desire she held on to despite the many directions she moved in, none which brought her closer to becoming a physician. As a child, one of her earliest aspirations was to become a rural general practitioner, but she grew up in the 1950s and 60s, graduating high school in 1969. It was a time when certain jobs, roles, and opportunities were still heavily stigmatized towards women. Discrimination ruled, so she went another way. Marriage, raising a family, and working for a telephone company, it would be another 2 decades till she became a college student and soon after a medical student, finally pursuing her goal to become a physician. Though the road was long, she was patient. She held on to that dream for decades. Most people would have given out way sooner, but her ambition stood the test of time. And because of it, she has fulfilled a lifelong desire, serving in family medicine and traveled to places like Alaska and Antarctica, and places and in between, gaining much experience in the medical field and many life adventures. Currently, she works in a village-based practice in Unalakleet, Alaska. What is she doing here? Well, she's obviously not done with her journey. Here to tell you all about it, please welcome Dr. Ella Derbyshire.
Thank you. Thank you very much. I am a local girl. Actually, I grew up maybe 3 miles from here, over in Winenskill. When I was growing up, this was a farm field, and a young girl could go riding over the fields and running around and come over here and take a look at what was happening on the campus and the buildings that were going up. Back in 1969, when I graduated from Averill Park, it was difficult for women to get into medical school. It was difficult for them to actually pursue in college the courses that would be needed to get into medical school. But all that changed in time, and now we are able to pursue our goals much more timely. So I don't think there's too many people that waited quite as long as I did to become a physician. But it was a full life even before I became a doctor. So currently I'm working in Unalakleet, Alaska, which is a small community up on Norton Sound. And people seem to be interested in the indigenous peoples of Alaska, so I'm going to go with that particular presentation. The PowerPoint presentation, I haven't done one of these clickers before, and I hope that this goes fairly smoothly. I apologize if it does not. You guys will let me know if something's wrong, I hope. Thank you. The mic here? So if I move closer, you can hear me better? There we go. All right. So, anyone know what this is here? Whoops. Let me see here. What could that be? Does anyone know what this is here? Where's the pointer? This here. North Star? Yep. Up here's the North Star, here's the Big Dipper. From an astronomy standpoint, that North Star hangs over the North Pole, and I've been drawing this symbol since I was a very young child. It's one of those things that are very recognizable in the sky, and up in Alaska, it's almost overhead. So it's kind of comforting to see it when the sky is clear, and it's dark up there. So Alaska is the last frontier. It became a state in 1959, the year before Hawaii, the 49th state. It had a small population back then, a civilian population of maybe 150,000 or so. hasn't grown all that much since. It's the largest state in the Union with one of the smallest populations, and it is by far the least populated per square mile. The population density is pretty limited to large cities and then to small villages around the community of Alaska, many of which are not on the road system. Oddly, Anchorage, the largest city, has most of the population of the state. Fairbanks, much smaller. And Juneau, the state capital, rather small by state standards, and it's also the only capital city in the United States that isn't on the road system. You have to fly or take a boat to get to Juneau. The state per capita income is pretty good. It's $71,611, according to the internet. The unemployment rate in the state is 3.9%, which isn't bad. Alaskans like doing this kind of stuff, especially when it comes to Texas, which is formerly the largest state. Yeah, we got them beat. Much larger than any of the other states of the Union, but not very many people up there. So who works in Alaska? Who do they work for? So back in 2014 and 2024, you can see that Providence Health System, a healthcare provider, is the #1 employer in the state. Alaska Native Tribal Health Consortium, South Central Foundation, Foundation Health Partners, and Bristol Bay Native Corporation in 2024 are all major employers. So providing indigenous people of Alaska with a healthcare system that they could use, most of them living off the road system, right? They came up with 1994 with the Alaska Tribal Health Compact, which is funded by the IHS, but managed locally by the tribes. And using that compact and the money that it provided, there are hospitals located in some of the larger communities of Alaska. Anchorage, again, by far the largest one. Barrow up in the North Slope Borough, Bethel, Dillingham, Kotzebue, Nome, Sitka, and Wrangell. There are also tribal health centers. Most of those are on the road system. 148 community health aid clinics. And the community health aid is a special position in Alaska. They don't have them elsewhere. And these are people that are trained to provide health care in remote villages where they don't have doctors. The Alaska Native Medical Center in Anchorage is a statewide center for the Native Alaskans. And I had the privilege of working in 3 different hospitals over on the west side of Alaska. So up in the top there is the Northwest Arctic Borough, the Nome census area, further south, and then Bethel. So these are Native corporations. Counties in Alaska are called boroughs or census areas, and they do have something like a county seat, and that's usually where the hospital is located. So the Northwest Arctic Borough has a small population, especially compared to cities like Anchorage. It's almost 80% Alaska Native or American Indian. The poverty rate there is much higher than in the rest of the state of Alaska. It's got a large land area, and the population density is really quite low. Unemployment is high, and this unemployment figures in Alaska, I noticed that they're assuming that someone has worked and they're no longer working. There are a lot of people in Alaska who don't have traditional jobs where you go to work at an office and you get paid. There's a lot of subsistence up there. The environment is Arctic tundra. There are 11 native villages. The major population center is Kotzebue, which serves as a county seat. And the major employers there are the school, NANA, which is the Native Corporation, and Manilik, which is a not-for-profit organization that runs the healthcare. This is the Manilik Health Center in Kotzebue, Alaska. It was built in the 1990s. It has most things that a small hospital down in the lower 48 would have. It's got an inpatient department, outpatient department, a pharmacy in the hospital, which is, by the way, the only pharmacy in town. It's got an eye clinic. It's got most of the things that you need, but not everything. So these are usually primary care providers here. To get primary care, people in the villages that need a doctor would come to Kotzebue. Sometimes the providers go to the villages to provide care there. If they need care that can't be provided because it requires a specialist, like a cardiologist or a pulmonologist, either the specialists come to the hospital or the patients go to Anchorage. So there's a lot of travel involved to get people to where they need to be. And again, it's not on the road system, so we're talking about travel by airplane. In the Northwest Arctic Borough, Kotzebue is on the end of the peninsula, the Baldwin Peninsula there. And you notice that there's communities that are on the Kotzebue Sound. There's also a lot of communities that go along the river. And that's kind of the way most of Alaska works. The old communities were on the river. That's where people fish. That's where they have their transportation to get from point A to point B. Then they were kind of nomadic. Now they've kind of settled down, but they settled on the banks of the river. Up in the north here, if I can make this work, and I can't, you'll see the village of Point Hope. Point Hope is not a member of the Northwest Arctic Borough. It is the North Slope Borough. But under contract, we take care of the population of Point Hope. So Kotzebue is the gateway to the Arctic. It's got a population that hasn't changed an awful lot. It's gone down actually a little bit. The land area is smaller because it's they call it a city, the city of Kotzebue. The density is quite high because it is the city area. Per capita income, you notice, is quite a bit lower than in the state. The unemployment rate is still okay. The poverty rate's a bit higher than the state. And the major employers are the two major corporations, the for-profit and the not-for-profit organizations of the tribe. So it's a seat of government, so people convene there from other villages. It's 33 miles above the Arctic Circle. It's accessible by sea from Kotzebue Sound, and the river communities are accessible by boat or by plane. There are 2 Alaska airline flights daily from Anchorage if the weather is good. Regional flights take people between the villages of Kotzebue and the villages in the Northwest Arctic Borough, but they also go to other locations as well. And there's no service between the villages and the outside world. So in Kotzebue, the shortest day is December 21st. The sun just peaks above the horizon and quickly goes back down again a few hours later. The longest day is sunrise on June 2nd, and it doesn't go down again until July 9th. I believe that people probably do better when they have daylight and darkness, and the summer days are days when the folks up there are doing things like subsistence, picking berries, hunting, fishing, and doing the things to get ready for the winter, traditionally. And that tradition carries on even today. The average temperature is quite low, minus 48. Been there, that's not very kind. 80 degrees also feels very hot up there, although it's not so bad if you're from New York. The average precipitation is quite low at 10 inches. It used to be a desert, so the precipitation has actually gone up a bit. So the villages, they're isolated communities. They're isolated from Kotzebue and the outside world, but also from each other. But there is river access and boats and barges that can go up and down the rivers and up and down the coast to make sure that people are supplied with the things that they need, like fuel. When the rivers freeze in the wintertime, then snowmobiles can use the rivers as roads. So that's a time when you can get from one village to another. But often people travel by the small regional planes. Jobs are kind of scarce up there. There's a subsistence lifestyles that are becoming more difficult because it's becoming more expensive to live up there, even for people who are indigenous to the area. Each of the villages has a post office, an airstrip, an IRA, a store, a clinic, and a school, and that's pretty much where the employment opportunities lie. Most of the villages have potable water. Sometimes Kivalina, they have water when it doesn't freeze. If you freeze in the wintertime, you have to wait till spring to get your water back again. But villages like Kivalina don't have piped water, so they have to haul water from a common area. So here's the river road that goes between Selawik and Kotzebue I think this was around November. So bearing airplanes, when I say small planes, I mean small planes. This one's, I think, the smallest, but usually they're like
an 8 or a 10 passenger plane that will shuttle people back and forth between the villages. So Point Hope is a member of the North Slope Borough, and it contracted to Maniluk for their health care. So it's a population of 830 people. It's on the Lisbon Peninsula and the Chukchi Sea and the Arctic Ocean, and it's probably the location where people thousands of years ago, tens of thousands of years ago, came over from Asia and crossed a bridge that used to connect Asia and North America. So the people in Point Hope and their ancestors, they've been there for a long, long time. The per capita income is a bit lower there than the state standard. It's $56,250 per the internet. The unemployment rate is a lot higher than the rest of the state. The poverty level is also a lot higher, and it relies very heavily on subsistence hunting, so whales and walrus and seal and caribou, moose, the things that come from the sea, and then berries, and maybe the birds and the eggs from the tundra that can be collected there. So these are polar bears. They do live up in that part of the world. They do come on land. If you see a polar bear, it's probably not a good idea to stick around. You want to make sure that you're taking care of yourself and watching out for your environment when you're up there. So the marine mammals provide the food, the fuel, the clothing, the art. They also provide things of cultural significance, the stories, the dances, and the celebrations of the people. So one of the things that are produced in Point Hope, because they hunt the bowhead whale and because they have walrus up there, we get these beautiful baleen baskets. And this is one of the sources of income to the community. People weave the baskets and they're sold in Kotzebue or in Anchorage, or some people will actually sell them up at Point Hope in the village. They don't have to leave. The village that was once upon a time the largest one in the Northwest Arctic Borough, it's kind of lost its place, it's lost population, is Selawik. It's an interesting place for a number of reasons. The poverty level there is much higher than in Kotzebue or in Point Hope. The unemployment rate is high. It's an inland community with an elevation of about 110 feet above sea level, but it's kind of boggy and swampy. They have great berries there, but it's hard to build things and have them stay up, and it's hard to have a road. So their major employers are Selawik City, the school district, the IRA, and Maniluk. Most people there don't work. They actually do subsistence. This is a she-fish, bunch of she-fish. You catch them in the wintertime. You go out on the ice with a bucket, a hook on a stick, and then a hammer to kind of calm them down when they come through the ice. And they're rich in omega fatty acids, and they can be just frozen like this and brought inside when the time has come to eat them. This is the village of Selawik. You'll notice housing of different ages. There was some housing from the 1950s here and some from the 70s and 80s. You'll notice that a lot of the houses are on stilts. Some of the older houses have sunk into the ground, and they probably won't be standing there too much longer and have to be replaced. So making a living in Selawik, got your subsistence. You're supplemented by bartering, so they can trade for beluga whale and for fossils and seals that they get from the coast. They make birch baskets, not baleen baskets. They have skin masks and ivory and other art things that are sold in Anchorage at the gift shops and in Kotzebue. And there's seasonal work outside of Selawik, and a lot of the guys particularly go to like Red Dog Mine, to commercial fishing, the Bureau of Land Management for fighting fires down in Oregon and Washington State and California, and the US military. So the tundra berries are abundant there. This is great. But again, the land that they're building on is kind of squishy. And so they don't have a road per se, they have a board road. And this is erected about maybe 10 feet above the rest of the tundra. The water pipes that you see going under there are bringing water into the community. They do freeze sometimes in the wintertime, leaving maybe half or all of the village without water until things thaw up again in the spring. So there were some problems with communication. So they kept on asking for federal funding to help repair their boardwalk. And the federal government kept on saying, no, we don't repair boardwalks. It says, it's not a boardwalk, it is a board road. This is your transportation. It's like fixing a road in the pavement or building a bridge or something down in Little River 48. You try to get the money that way, and it's not for entertainment, it's actually to get around town. And we finally were able to get some funding to get things fixed again. You'll notice that things are kind of rickety here, and they do drive four-wheelers on it. There aren't too many cars. Actually, I think there's only 2 cars in all of Selawik, but it's four-wheelers and snowmobiles that mostly use the board road. This was the old clinic back in 2010. It has since been replaced. It had 2 examination rooms, and up above the offices for the Manilik in Selawik. Behind there is an apartment building that was built fairly recently, and in there, people are able to live. It's less expensive to heat them. They're kind of a closer community in there, and probably this is the way that housing in Selawik is going to continue to go. The new clinic in Selawik was put in there in 2012. It's larger, it has more exam rooms and more places where they can have things like physical therapy, the dental office, the eye clinic can actually go out there. So it's a good step up for the villages. And this is an IHS model, so you'll see this kind of a clinic now throughout Alaska in Indian and Eskimo territory. So house calls in Selawik, Alaska, sometimes it's better just to use the river route. So you pull up to a house, you get out of the boat, and you go and knock on the door. Their patients will accept you as a guest while you're seeing one of the members of their family in their home. Here is the waiting area at the Selawik Airport. I used to call it Gate A. There are no buildings to stay in, so in the wintertime, you're out there in the cold. In the summertime, it's rather pleasant, but in January, that's a whole different story. So you said that Manilik is a tribally owned, not-for-profit corporation. It provides health care for federally recognized tribes in the Northwest Alaska. It provides social services and assistance to the Arctic Borough and to Point Hope. It coordinates traditional and tribal assistance programs, and it coordinates environmental and subsistence protection services, and it has over 550 jobs, which is a good portion of the jobs in the community. So they have a regular hospital, inpatient, outpatient, ER, X-ray. They got themselves a CT scan about 2010, a laboratory, and again, the only pharmacy in town. So contract services, there's an eye clinic, but there's a guy that comes in now from another community to do the eye care. Audiology, radiology, those are specialists where we take the pictures, for example, for the x-rays, and they get sent to an organization in Hawaii who reads the images. The air ambulance is operated by Guardian Flight, and the specialty clinics are providers coming from other places up to the Manilik Health Center to see the patients closer to where the patients live. So here are the villages in the region. And again, the brother villages usually have water, sometimes not. Kivalina has no water. It's on a spit of land that's low gravel. And it's probably going to be one of those places that quickly gets washed into the sea with the global warming. Every time the area gets hit with a winter storm, Kivalina no longer has the ice protecting it from the sea. And the plans are to move that community elsewhere where it's higher and safer. So further south, we have the Nome census area, Norton Sound Regional Hospital. This is my employer in Nome. I work in the city of Unalakleet. It's a city by Alaska standards, not necessarily by New York standards. The Nome census area only has, it's got less than 1,000 residents. The city of Nome contains about 1/3 of them. The land area is large, and it's a community surrounding Norton Sound, which is a pretty good-sized body of water. The per capita income there is much less than in either the Northwest Arctic Borough, or all of Alaska. 75% of this population is Alaska Native or American Indian, and it's a mix of Inupiat and Yupik. Up further north, it tends to be Inupiat, Yupik towards the center, and then you start getting the Indian tribes down in the southern part of the state. The poverty rate here is 21%. So the medical service that we offer, we got the usual medical providers. We also contract with Wilderness Medicine, trying to get providers out to the villages to see people where they live rather than bringing people into Nome. The staffing for NPs and PAs, it would be nice to have one of those providers in every village. That's kind of the goal, but we're having some trouble getting people to come up and work there. So, medical services, again, the only pharmacy in town. They've got the emergency medical services. Nome just took over the ambulance services from the city of Nome. They've got the ancillary services. The Quayna Care Center is an assisted living for old folks. They have the infant learning and the tribal healers, disability services. So they offer a lot to the population. The village clinics are located around the Sound. They don't go too far away from the water here. Little Diomede, that is the place in Alaska where you can look out your front door and you can see Russia. It's called Big Diomede. That's just right across a small body of water. Diomede doesn't have water, running water. Stebbins, Shishmaref, Teller, and Wales also don't have running water. Shishmaref has the same problems that Kivalina has. It's on a gravel spit, and it's in danger of being washed into the sea. My current village, other than Unalakleet, is Koyuk, and I make trips there for a week, 4 or 5 times a year, to see patients where they live. This is the Yukon-Kuskokwim Health Center in Bethel, Alaska. It's further south. This is a much larger hospital for a much larger community over a larger area. So provide services to the Bethel service area and the Kuslovik census area as well. Population is 28,000 people, much greater than Nome and Kotzebue. It's got a lot of square miles to it. The average per capita income in the census area is $25,000, almost $26,000. But the average per cap further north in the Kuslovik is much lower. The Bethel Hospital has quite a bit of capacity, 13-bed ER, much bigger than the hospitals further north, more inpatient beds. They actually have surgical OB. So this would be a community where the women don't have to go quite so far from home in order to have babies. They've got the lab and the radiology and the pharmacy and all that, but they have 53 village clinics and 5 sub-regional clinics. So it's a much, much larger area. So the villages are listed here. In bold, you'll have the ones that do not have running water ever. The sub-regional clinics, the 5 are in Amac and Emonic. Emonic is actually close to Unalakleet. Hooper Bay, St. Mary's, and Tooksik Bay. This is the Alaska Native Medical Center in Anchorage, Alaska. This is kind of like the mothership for all of healthcare in Alaska. This is where the specialists are. This is where patients go when they need a higher level of care. They could potentially go to other places, but their healthcare at this hospital is free, just like their healthcare at the hospitals where they live is free. So if you're an Alaska Native or an American Indian and you walk into my clinic in Unalakleet, you're not going to get charged for the visit. If you walk into my clinic and you are not an Alaska Native or an American Indian, you do get charged. Some people get confused when they come to Alaska thinking that, oh, the health care is free in the villages. It's free to certain people. And those are the Native people that live there. So A&MC is a huge hospital, 182 beds. They have surgical services. They have a lot of the services that you would expect. They have a level 2 trauma center. It's the highest trauma center that we have in Alaska. The closest level 1 trauma center is actually down in Seattle, Washington. So A&MC can stabilize a patient before they send them on down to Seattle for definitive care. The specialists that work at A&MC make field visits to the native hospitals and the clinics out in the rest of Alaska. Some of them are on the road system, some of them they have to fly to. So specialist services are most of the ones that you would expect, but they don't offer all the services. For example, you don't see pediatric endocrinology on here or pediatric cardiology. Those services are provided by a different means, by contract health or referred services. So if they don't have it, A&MC will pay for, or the IA, Indian Health Service, will pay for people to go to a facility that does have the service that the people need. So village health care, 12% of the population in Anchorage is Alaska Native or American Indian, but the percentages are much higher elsewhere. About 20% of the residents of Alaska currently identify as Alaska Native or American Indian. Over half of those are living in remote villages. There's nothing that says that someone with a serious medical problem has to live in Anchorage, although that's where the doctors are. So if you have someone who's really sick, they can return to their home villages, and we will continue to provide the best care that we can in the villages where they live, which is important for people who want to be around their families. There are fewer medical providers currently living in the remote villages because they are remote villages, and most people kind of tend to gravitate towards large cities. Even the country doctors, this is more country than most people would like to have. As a matter of fact, it's considered remote medicine. It's not rural medicine anymore. The village health care is usually mostly provided by the community health aides under directions of physicians in the regional hospitals. So this is a typical design of a clinic. This one is in Shaktoolik. It's a new clinic, and it looks pretty much like the one in Selawik. The practitioners work in those clinics without a supervising physician on site. In order to be a health aide, you need an 8th grade education. You get special training to be a healthcare community health aide to provide care. You operate using a document called a CHAM, and this is kind of like standing orders for these health aides to provide care to people in the village without consulting with a physician. And when they go outside the CHAM, that's when the doctors usually get a call and say, well, I have this patient, and this is what we're doing. The CHAM says I have to call you, and then you discuss what's available for the patient in the village and make a decision about, does that patient need to come someplace else to get care? It's not a question of you get trained and then you're a health aide forever. You have to keep on training and be brought up to date, making sure that your skills stay up to speed. Some of the skills that you very seldom use in a remote clinic, but we want to make sure that you can do it. So the health aides live in the villages where they work. Their patients are their families. So if there is an emergency and someone crashes a snowmobile, these health aides are going to be taking care of potentially neighbors or family members, friends. So it's not an easy job. And there's a lot of turnover in the community health aide population. So Alaska Village Healthcare, 180 small village clinics, 600 community health aide practitioners out in those clinics. There's 125 behavioral health aides, 20 DHATs, dental health aides, dental therapists, and most of the home health care, let's say for example, you have someone who's older and they need some help at home. Here you get the visiting nurses to come. Up there, the services are usually provided by the family members. Something else that's a bit different, the morgues in the villages are in the clinics. There's no funeral home, so if a patient dies in the village, a resident dies in the village, they tend to stay in the village, and they're buried by their family in the cemeteries in the little remote rural areas. So, how to get people health care that they need. You could do it one by one, or you could do a health fair. This is a bunch of people getting on a plane to go to Kayana, one of the villages up in Norton Sound. So we have here people with the expertise in Kotzebue to do injury prevention, screening for STIs, screening for diabetes, measuring blood pressure, tobacco cessation. So they go out to the villages where they kind of get a little more bang for their buck and see a bunch of people and have some fun with the kids, telling them about, the icky lungs, how bad they look when you smoke. And yeah, it's a good time for both the providers and for the community. This is a typical classroom out in rural Alaska. It looks pretty much like a classroom in the lower 48. But they have some skills that aren't usually taught in Albany. So up in Alaska, if the meat on your table comes from hunting, it's a good idea to be a good shot. And so they actually teach hunting skills. This is from the Kayana High School. And actually, that's not a bad cluster there. So the Alaska Tribal Health System, it's a voluntary affiliation of the tribes and the tribal organizations providing health services to the Alaska Natives and the American Indians and Alaska Indians. Each tribe or tribal health organizations services a specific geographic location, with the exception of ANMC, which services all of Alaska. So the three locations where I worked, Benilik up in the north, Norton Sound, over, again, kind of mid on the west coast of Alaska, and the Yukon-Kuskokwim in the southern part of Alaska, are only a part of the other tribes that provide healthcare service. Most of these are on the road system. So once you get down towards Anchorage, South Central Foundation, Eastern Aleutian tribes, well, they're out on the Aleutian Islands, that chain of islands that goes out to the west from lower Alaska. So a lot of these are, Tanana Chiefs is over by Fairbanks, which is certainly on the road system. So it's a combination of being very remote or being close by a road and other facilities. So Manilik has 12 tribes associated with it in the Northwest District. The Norton Sound Regional Hospital is for 20 tribes, and the Yukon-Kuskokwim is 58 different tribes that they try to manage. So here's a kind of a diagram of what happens when someone is seriously ill or injured. They go from the local clinic into one of the sub-regional clinics, and then they get shifted down to Anchorage, or if there are no sub-regional clinics, they end up going, or regional hospitals, they end up going from, say, the Aleutians all the way into Anchorage without actually seeing an intermediate level of care. You'll notice down on the left, well, your right side, there is this area, the Southeast Alaska. They also have native hospitals, and they also refer up to Anchorage for their care. So there's challenges in providing care to Alaska. There's an increased demand for new things in medicine. So when something comes out, like a medication that you can take in order to lose weight, people are very interested in that, but they're not necessarily interested in making lifestyle changes that will help prevent certain diseases. So there's limited resources to meet the demand for essential services. I can't help but notice that the prices of some of the medications that I prescribe are extremely expensive. They're covered by the IHS and by the Norton Sound, but there are people that are on medications that cost $10,000 a month. That is a drain on the system, and it would be best if we could avoid the diseases that cause that kind of expense. The healthcare costs are rising. There's a lot of medical inflation. There's a lot of new things and a lot of advertisement to tell people that these new medical breakthroughs are available. There's been a degradation in private insurance coverage with high deductibles and then caps. So there's a little gap in the middle where you actually have benefits from the health insurance, but there's a lot of people who are not doing well economically because of medical expenses. There's the rising cost for patient travel and provider travel. And so it costs a lot of money to ship people from the local villages down to Anchorage or back and forth. If you have someone that's really ill, they might have to go to Anchorage once or twice a month. So the costs kind of mount up. And that's a cost that you don't usually have like in the Capital District of New York. And there's challenges of implementing and managing telemedicine. Some of it is regulatory. Some of it is because the communication system up in that area of the country is not that great. It's a little better now that we have Starlink, but it's still kind of challenging to make a connection between someone in a village and someone at a hospital in either Nome or in Anchorage. We have problems with people who don't have phone service. So if you want to call them and tell them to come into the clinic, you can't. They don't have a phone. If they want to do telemedicine on the phone, they can't do that because they don't have a phone. And it's hard to get them phones if they can't afford one. And for a while, we were handing them out, but we noticed that they were kind of disappearing, and people were giving their phones that they had for medical care to friends and relatives because their friends and relatives didn't have phones. So it's a little challenging. Some of the facilities are outdated and the equipment is outdated. That gets replaced, but it takes a little time. And of course, there's a far distance to tertiary care. So part of the problem I think that we're facing in Alaska is there's an erosion of traditional values. They're starting to adopt more worldview as far as what they want. For example, they like cars, they like snowmobiles. The dog sleds are practically gone. They have a lot of poverty and isolation, and they have a lot of mental health issues. There's lack of employment opportunities, and when there are opportunities to work, some of them prefer the subsistence lifestyle. There's increased rates of chronic diseases, certain ones, and a cultural disagreement about the role of healthcare. So doctors can be very preachy, right? So we like to tell people, you need to stop drinking, stop smoking, lose some weight, get out and get some exercise and all that kind of good stuff. But what they're looking for is to be healthy without doing that, just like other people everywhere else. So we have difficulty recruiting and maintaining medical providers because of where we are. And just force of nature that you don't have to worry about too many other places. You get adverse weather here, but the volcanoes that stop the planes from flying, the earthquakes, the climate change, not so much yet in New York. Alcohol in Alaska. So there's different levels of what kind of alcohol is allowed. There's dry villages where it's illegal to buy, sell, trade, or make or consume alcohol. Damp villages where there's no bars or liquor stores, and residents can bring in alcohol or they can make it, but public consumption is definitely discouraged. It's not illegal unless you've done something illegal while you're under the influence of alcohol. And then wet villages have bars and serve alcohol. The liquor stores, you tend to be in the larger cities. So there's a lot of politics with alcohol in Alaska. There are bootleggers who take advantage of the dry villages, but they're selling all over Alaska. They bring it in and sell it. And where we see alcohol, we see an increase in interpersonal violence and suicide. And the damp villages and dry villages are actually a little calmer, a little easier to manage as far as personal safety is concerned and mental health. But the local revenue generated by having a wet village can be considerable. And the question is it worth it? And probably you have to weigh, what's valuable to your community. So there's definitely more crime, there's more motor vehicle accidents with alcohol, more domestic violence, more depression and suicide, and more drugs abuse are competing with alcohol sales throughout Alaska. So we're not only dealing with alcohol, sometimes we're dealing with people bringing such things as meth, cocaine, other things that are problems in the lower 48. So pregnancy in rural Alaska, this is something that kind of gets on my nerves. Prenatal care is available in all of the villages, but the villages are not set up to deliver babies. So if you have someone who is pregnant, requires OB care, they have to go outside of their community. If you live in Nome or you live in Kotzebue, that's fine. But if you live in a village like Kivalina, you have to travel to Nome in order to have that baby. So some of the women go automatically to Anchorage. If you have someone with a serious complication or they've had problems in pregnancies in the past, then they get to travel to Anchorage. So they're away from their families. So when they took birth out of the village, you leave at 37 weeks, you might not deliver till 41 weeks. You got high-risk OB that have to go in even sooner. And sometimes they boomerang back, and the next thing you know, you have a high-risk pregnancy out in the village, delivering, where they don't really have the level of care that they need. Escorts are allowed only if the woman is expecting twins. So the partner can't go, the children can't go, and it separates the women and they're alone, which isn't, well, I think that they would be better off if they had someone who could support them. The practice deprives the villages of participation in the birth of their children. And when you do have a village delivery, it's quite an event. The baby tends to get taken out of the birthing room pretty quickly and passed around, and mothers congratulated, and everybody is smiling. And it's actually something that they really seem to enjoy, but it's something that's quite rare. Cancer in Alaska, another thing that's kind of difficult to deal with. We have CT for screening for lung cancer, and smokers who have more than a 20-pack year history can get a screening scan once a year. Some of these people will reach the 20-pack year rate at the age of 25 or 30 because they're smoking 2 packs a day. Pap tests and mammograms are available, but they're not always accepted. It's not something that people want to do or consider important. But we have high rates of lung cancer, colorectal cancer, liver cancer. That's probably due to, partly to diet. Hepatitis B is a problem up there. Hepatitis C is a problem up there, and there's an awful lot of autoimmune hepatitis. Stomach cancer is quite high, and we're trying to figure out what that is. They're thinking that maybe it's a problem with the Helicobacter pylori. That's also problems in there. Okay. Okay. That was my assistant. So we have prevention programs, but we try to find cancers before they become a problem, and we try to prevent them if we can. So it's very expensive. There's logistical issues. The population is slow to accept preventative care. Education and technology could bring jobs to the area, but it would impact that subsistence lifestyle. Global warming is a threat to Alaska, probably more than to other areas of the world other than perhaps Antarctica or around the equator, where they're seeing more and more difficult storms. So, see, I timed that kind of okay, huh? So, do we have time for questions?
A little bit of time. Hello, everyone. I'm Amy Posner. I am the Director of Donor Experience Alumni Engagement here at the college. So I welcome any of our alumni. I just want to point out that Hudson Valley Community College alumni go so far all over the globe doing wonderful, great things for the world. We are really almost out of time. We have time for just a couple of questions. So anybody have a question?
Well, there are some interesting things that are used locally. There's ICBIC down in the Yupik areas. There are actually medical and recreational marijuana are both legal in Alaska, but not available in the villages. Those are available from dispensaries in places like Anchorage. we don't provide those to the patients.
Non-healthcare related question, but since you're a resident there, I was curious. On the heels of this national election, I was watching a program that said Alaska hasn't gone Democratic since John F. Kennedy. And I was wondering, since climate change is typically more of a Democratic concern, what are your thoughts or inclinations as to why Alaska seems to vote Republican?
I don't know. There are, probably maybe it's a more independent area than the states, and they rely more on their local communities. So that might have something to do with it, but you're right, it's a very red state. Yes?
Hi, thanks so much for your talk. You had mentioned earlier about some training for health aides.
Yes.
And what they do. Does the university in Alaska, do they have a medical school?
No.
Or no? So you're not able to draw from them to
No.
assist with your work?
There's no medical schools in Alaska. We go with WWAMI, which is a number of Western states don't have medical schools. So that's where the people from Alaska that want to be physicians come talk about challenges to becoming a doctor. But yeah, they provide residency programs, and there's one at Providence in Anchorage. It has a family medicine program. Yes, in the back of the room.
Yes, so I guess I immediately go to call it data talk, to effects relative to infant mortality and life expectancy in those areas. Are they low or at national average levels?
The life expectancy is lower. The infant mortality rate depends on where you are. I don't know the statistics compared to the lower 48. I know that infant mortality is probably rising everywhere. So I can't give you those numbers, I'm sorry.
Any other questions? Well, thank you all so much for coming to the Voices lecture today, co-sponsored by the Hudson Valley Community College Alumni Association. There were some snacks, I think, on the table outside, as well as some giveaways. Please feel free to take. And thanks again to Dr. Derbyshire, who has proven once again you can do whatever you set your mind to do. Thank you all.